Good afternoon. My name is Yvonne Aspilcueta, and I'm the data analyst for the project plan for the next influenza season. And I'm here today to share with you my insights and recommendations to help the medical staffing agency to provide the necessary medical workers to clinics and hospitals for the upcoming influenza season. The data I work, it was the influenza death by state from 2009 through 2017, which is coming from the Centers for Disease Control and Prevention, CDC. The data is reliable and trustworthy, coming from a trusted government entity. I also worked with the U.S. Census population data from 2009 through 2017, which is coming from the U.S. Census Bureau, a principal agency of the U.S. Federal Statistical System, a government agency. Data is trustworthy since they are dedicated and they are the leading provider of quality data about America's people. Having these two data sets, what I did was integrated by merging the influenza deaths data with the census population data. For the influenza death, I changed the value suppressed equals to 0 because according to the CDC about death suppressed, death counts and death rates are suppressed when the data meets the criteria for confidentiality constraints. No counts of records were available, and it is represented by 0 instead. For the census population data, I removed Puerto Rico since it's not included as one of the states for this project. Now, for our goal, it is to help the medical staffing agency that provides temporary workers to clinics and hospitals on planning for influenza season and time when additional staff are in high demand. The motivation of this project is hospitals and clinics need additional staff to adequately treat patients, particularly those in vulnerable populations who develop serious complications and end up in a hospital. Objective: it is to determine the time and quantity of temporary medical staff to each state. Scope: the agency covers all hospitals in each of the 50 states of the United States, and the project will plan for the upcoming influenza season. Now we can observe in the graph two age categories about the mortality death caused by influenza. One is the population under 65 years old, marking orange, with the total death by influenza of 36,153 people from 2009 through 2017. And the population 65 years old and older, with 379,266 deaths caused by influenza, being this population the most vulnerable population by influenza. With this first insight, I created two hypotheses. One is if the vulnerable population is 65 over, then the mortality rate will be higher. And if the number of vulnerable population 65 years older is higher in the most populated states, then more staff is needed. With these intakes, take us to the next slide, which is the comparison death by influenza between populations under 65 years old and 65 and over. In this slide, I split the population age under 65 years old and 65 years old and over. We have three graphs. We can see the population of 65 years old and over have the higher death by influenza than the population under 65 years old. Also, they have the higher death rates by influenza. And we can see that the most populated states have the higher death rate by influenza, like California, Texas, and New York. On the next slide, we can see the correlation between the population and death by influenza. The correlation describes the strength of an association between two variables. In this case, it is the USA population and the death rate by influenza from 2009 through 2017. The graph below shows the total population and the mortality of age 65 and over. We can see that there is a strong correlation that the population of age 65 and over are the vulnerable population by influenza. We can clearly see the population under 65 years old are less impacted from death by influenza here. On the next slide, we can see that influenza over time from 2009 through 2017. I divided the geographical view into 4 regions: Midwest, Northeast, South, and West. We can determine that the vulnerable population throughout the years has been the populations of 65 years old and over. Now, my recommendations and next steps. Send results and determine next steps in collaboration with the stakeholders. Focus vaccination campaigns for the group age 65 and over by prioritizing the campaign in that age group. Increase the staff number in those states with the higher rates of mortality by influenza. Provide educational material to increase knowledge to change the perceptions towards influenza to increase healthy and preventive behavioral practices, especially in the most vulnerable population. This concludes my presentation. If you have any questions, please reach out and I will be happy to give you an answer. Thank you.